Hey, listen up. Have you ever gotten a MyChart notification and the first thing you do is open it up and see what the results are? And then you start reading about it and you're like, oh my god, I'm dying. And then your doctor's not getting back to you, like, what the heck? And then you call them and send a message, you're like, oh my god. Step 1, do not freak out. I'm going to do this mini-series where I go over some of the basic blood test types that your doctor may order and go over what these things actually mean. And today we're going to start with the CBC, or complete blood count. I'm not a big fan of the name complete blood count because, sure, it's all the different cell types, but people see complete and they think we're checking everything in their blood, which isn't necessarily true. So the main things we're looking for are the white blood cells, the hemoglobin, which is part of the red blood cells, and down here, the platelets. So the white blood cells are important for basically like your immune system, how well you respond to infections, things like that. Down here, you'll see all these different things: neutrophils, lymphocytes, percentages, blah, 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 and then numbers. All these things we don't really look at typically from a primary care or outpatient perspective. In the inpatient world, if someone comes in with sepsis, we'll take a look at these numbers. Some of these numbers can be elevated with allergies and also certain types of vasculitis and autoimmune disorders, but typically these things, when you see them on a regular blood test, yeah, it's okay. Next is, oftentimes I get patients who ask me about the RBCs being abnormal, but more so we care about the HGB, or the hemoglobin, which is the part of the red blood cell that carries the oxygen around. The HCT, or hematocrit, is in line with the HGB typically. It's a ratio, so if the HGB is high or low, the HCT should follow suit. HCT abnormalities on its own can signify certain things, but that's usually the hematologist to take a look at. Next number, we look at the MCV. This is the size of the hemoglobin, the red blood cells. I'll go over some of that then. All these numbers down here, the MCH, MCHC, these things, honestly, I don't even know what they mean. Hematologists will look at them, but for a basic blood test, we don't really care about them. PLT is your platelets. This is the number of platelets that you have. It's not necessarily a signal of how well you're clotting. Those are other tests. Now, with all that said, what these different things mean, what do all these numbers mean? All right. Keep in mind these are ranges. Ranges. All right. Being out of this range slightly doesn't necessarily mean that it's a problem. There are people who genetically have low WBC counts. So what's more important is what's your normal? What were your previous numbers? A low WBC, typically not as exciting, although like really low numbers are a problem, especially if patients have certain types of cancers. High WBC can be a signal of infection or certain types of leukemias. The HGB, low HGB, hemoglobin, meaning anemia. Anemia can come from different reasons. High number of HGB, typically not as exciting, however, can be signaling hemoconcentration or dehydration, or patients who have a smoking history or COPD can have higher number of HGB because your body's trying to produce more of it to carry the oxygen around. If someone has a low HGB, the next number we look at is the MCV to take a look at what is the cause. Low MCV typically would signal something like an iron deficiency anemia, or if there's like a slow bleed in the colon or somewhere like that, that can be slowly trickling blood. And high MCV can signal a vitamin B12 or folate deficiency. Low platelet counts can be evidenced in liver disease, certain types of bleeding disorders. High platelet counts can be a signal for certain types of liver disease as well, or inflammatory process, acute phase reactant, meaning if you have an acute infection, this number can go up. So to wrap it up, those are some of the basics for the CBC. Again, rule number 1, do not freak out. Rule number 2, take a look at what your previous numbers are. Number 3, these are ranges. So even if it's slightly above or slightly below, doesn't necessarily mean that something is wrong. And number 4, please give your clinicians some time to respond. They're seeing patients, they have other results to get to, so they will get back to you. Alright, I hope you found that helpful. I will be going over some other blood work as well. If there are any specific blood work and or other tests that you would like me to kind of give a general educational about, please let me know, leave it in the comments. This is not meant to be official medical advice, so if there are any specific medical questions, please ask your primary care provider. Bye!